So first of all, I would like to say that I really appreciate the fact that you have organized today's meeting. We see stakeholders from different fields and of course different people from different political backgrounds. So therefore, that means that around this issue, we can be united in moving forward in finding the right solutions to tackle again the issue of cancer, and of course coming up with clear solutions and immediate solutions. Because like you said, we simply need to look at the numbers. 3.5 million people in Europe are diagnosed with cancer, and we have 1.3 million people dying because of that. So therefore, if we look at the numbers, that means this is an urgency at European level, and this should be dealt as a European issue with clear results and clear programs. We are really happy to see that the European Union has come up with a plan, with a program, that there have been consultation around the proposal of the European Commission. We are going to have a discussion, an interaction between the European Parliament and the Commission on that topic. The European Parliament is going to, of course, initiate a special committee in charge of this issue. We are going to try, of course, to raise the issue at the top level, but also push forward in order to generate concrete results and concrete steps. One of the most important steps, in my opinion, beyond the Horizon 2020, Horizon Europe program that you have mentioned, is also the fact that the European Union has come up with a proposal, especially in the recovery plan, to initiate the health program, something that has been requested for a long time by members of the European Parliament, that goes up to 9.3 billion euros. Within this program, we have to have cancer as a top issue. And of course, we have to deliver funding to the players, stakeholders involved in the process, but we also have to make sure that we create synergies at European level with stakeholders involved from all over Europe in the process, and make the resources available for everyone. Because like you noticed, and like your distinguished guest has presented earlier, there are huge, let's say, gaps between Europe, huge differences between member states, and we have to tackle this issue. It's not normal that someone in Romania with cancer has lower chances of surviving than someone from Italy or from France. Of course, this will not be an easy process. This implies to have, of course, a European plan, but also to have a national plan in the field. The fact that we don't have a current national plan, this is, again, in my opinion, a big problem, a big issue. And we have to push for a national plan as fast as possible. Of course, this national plan on cancer has to be integrated in a bigger health program and a health plan that we have to have at national level. And of course, based on those specific documents that hopefully will be approved by everyone and accepted by all political parties, we can really have the possibility of getting access to funds and bring money within Romania, most especially, but also make sure that we reach people, because this is quite important. Again, sometimes to have the funding, but the funding doesn't reach people, doesn't reach patients, doesn't reach doctors. So therefore, of course, it's important to think at health as a topic that is not a policy-based topic. I really strongly support the idea that is also mentioned in the document of the Commission. Health in all policies. We need health in all policies, and that means prevention, like you mentioned very well, but we also need, of course, treatment. We also need digital tools. We also need innovative tools. We also need to make sure that we help patients once they are recovered, because because we all know that there are problems after that if patients are not supported enough. So therefore, I was a strong supporter when I was a minister, but also in my previous capacities of the fact that Romania has to become an active player in the field. This is why I supported your initiative to organize last year that very important event on this issue during the Romanian EU Council presidency. I believe we should do more on that. Again, I call upon my colleagues that are also present here to try to work together, because at the end, it's about saving lives. Of course, more has to be done, and I really believe, and this will be my last point, I know we have short interventions, I think e-health offers a lot of opportunities, and I think having a common database at European level can be helpful, of course, respecting data protection and personal data, but we can do that if we involve citizens, like you said, Marius, in your document. I think citizens' involvement can enable us, of course, to resolve this issue that sometimes is being raised. We also have to make sure that we use big data, that we use artificial intelligence. This is also mentioned in the European document. But of course, to do that, we need, of course, to involve all the stakeholders involved, patients as well, doctors associations, NGOs like yourselves, research institutions, to make sure that we have really an added value and we exchange knowledge. So transfer of knowledge, I think, is essential, like you said as well. But also all of those elements and those new tools that we are implementing and that we have to bring on board across Europe. So we have to make sure that everyone has access to it, has also to be, let's say, seen and also present in the training and the education of doctors and nurses, because of course it's good that we are introducing all those new technologies, but we have to make sure that people, especially the ones delivering treatment, can use those technologies. So we have to invest a lot in that. So this is why I finished by saying we need health in all policies, and especially on cancer, we need everyone to be on board and really be focused, because like everyone said, there are cancer can be prevented in many situations. And of course, if we work together, we can really reduce the number of deaths generated by cancer. So thank you again, and congratulations for this very nice and important event.